just rewind. Put your mind on pause, cause it's sleep time. Go ahead, relax and unwind. Get everything you need to feel your night. You might just be a little cranky, but we got what you need to wake you up. And if you will, we'll teach you all you need to know about sleep.
In the midst of a pandemic, insomnia is on the rise, impacting people's physical and emotional health. We're here today with Dr. Bijwadia to talk about coronasomnia. Welcome, Dr. Bijwadia. Thanks for joining us.
Thanks, Lisa.
Dr. Bijwadia, what is coronasomnia?
Coronasomnia, Lisa, is a term that some sleep physicians have used to describe the confluence or the addition of two really significant pandemics that have occurred in the United States. So, of course, everybody knows about COVID. That has obviously taken this huge and tragic toll on the United States. But prior to COVID even occurring, there was this pandemic of insomnia, which is the trouble either falling asleep or staying asleep. And about 20 or 25% of patients in the United States probably have some difficulty with sleep. Now take the anxiety that's associated with COVID and superimpose that on an already existing pandemic of sleep disorder. And that's what we call coronasomnia. It's in fact amplified the problems that people have with their sleep during this last year or two. And it's incredibly important how all of this impacts a person's ability to either fall asleep or stay asleep. And not only that, the worse you sleep, the worse your anxieties become. So it's like a vicious cycle that feeds on itself. And there is no wonder that so many people are now coming to sleep physicians like myself and our other colleagues to talk about these issues and see what they can do about it.
What I've heard is sometimes if you've got that anxiety, maybe stay away from the news for a little bit, get outside. I think being stuck in your home or feeling like you should be in your home versus getting out into some fresh air. What are some things that people can do to kind of combat the anxiety and the lack of sleep associated with all that's going on with this global pandemic?
Sure. I think one of the advices that I share with my patients is try to understand what you can and you cannot change. And what you cannot change, maybe you take that in stride and put it in a larger perspective, right? COVID is here and it's going to stay with us. We're going to have to learn how to deal with it. And if we can put that perspective into our overall health, how we eat, how we work, and how we sleep, all of a sudden things become a little bit easier to deal with. And I think that for patients who are struggling with these issues, just having a conversation and putting their mind at rest and thinking about what are the positives that can come out of this. You know, maybe some patients who have COVID anxiety are actually at home. And now they have a much more flexible routine. How about taking advantage of that and allowing themselves to have a more structured sleep time so you know when you're going to fall asleep and know when you're going to wake up, which was actually quite difficult when you have to wake up and go to a job every day.
Right.
So there are certain things that you can actually take advantage of and put in a positive light rather than a negative light, and think about how you can live your life in the midst of uncertainty, but have a certain sense of peace and restfulness that also allows you to sort of fall asleep and achieve that natural state of relaxation that we all need. And that's going to help you deal with the day better.
I can personally say just from the pandemic, my busy lifestyle before and then just the all of a sudden shut down, definitely it was very challenging for me on many levels. I've always slept fairly well. But I think that it's important that people understand that it's not normal not to sleep. So if you are having these issues, there's no shame in picking up the phone and calling a mental health professional and trying to work through some of that anxiety or some of those fears, as well as, contacting a sleep physician. What kind of advice might you have, on somebody who's, has slept before but kind of started not to, has never really had anxiety? What's the next steps for them?
I think it's important for patients to understand the relationship of healthy sleep with healthy living and a healthy mental health, right? So if we take all of these into consideration, it is not abnormal for us to have disrupted sleep that impacts our health and then impacts our emotional and mental well-being. So if you can fix one of those things, everything is going to get better. And so thinking of sleep as something that's important, that needs treatment, and that can be corrected is the first step. And take sleep seriously, because sleep impacts every part of our life. Again, mental, physical, and emotional. Paying attention to sleep health is absolutely critical.
I would say it's the foundation of wellness.
Absolutely. Exercise, nutrition, and sleep. I think if you can get those three things right, you're probably going to live a better life.
Very good. Well, thank you for the information. And definitely, if you're struggling, reach out to a mental health professional or a sleep physician. There are solutions for folks dealing with the pandemic and all the anxiety and sleep issues that it does create. Thanks again, doctor.
Thank you.